Welcome to Safe Coalition Confronting Our Crisis. I'm Dr. Ann Bergen, co-host of this series of programs along with Jim Derick. Jim graciously included me in this series, which is devoted to keeping the crisis of substance use disorder front and center, raising the collective consciousness of all members of our community. This is our crisis because as members of a community, we're all impacted. It's a health crisis, a safety crisis, a financial crisis, which cuts across all age levels and socioeconomic levels. But as members of the human race, it's a moral crisis as well. It is our crisis. Jim has devoted his life to doing all he can to support individuals and, of course, their families who are all impacted by this disease. He knows firsthand the devastation, along with the other leaders, devoted leaders of the SAFE Coalition. He's leading a sort of a two-pronged attack, providing support and resources for all of those afflicted, but also in the whole prevention area, trying to do all that he can, and the SAFE Coalition trying to do all it can, to end this scourge. So today, and we have, of course, Jen Knight, who is the vice chair of the SAFE Coalition, and she also has devoted so much of her time, energy, and passion into really addressing this whole issue. So we're so glad to have you here. I'm going to turn it over to Jim and kind of update us on everything that's been going on.
Thank you, Ann. Thank you. And thanks, Jen, for being here.
Thank you for inviting me.
Not that we don't see each other a lot, but I'm thrilled to see you. I, as I said to someone the other day, I'm always reticent to use the word president of the coalition because it sounds like I'm actually responsible for something. And the truth of the matter is Jennifer is the founding member of the coalition, along with Jeffrey Roy and a couple of town council members. So we're really indebted to what you've done and happy that you're here today to provide an update on what's going on at the coalition.
Thank you.
So I thought what we would do is we would start just with some basic things that are coming up, that the coalition has coming up. Importantly, February 15th at Franklin Fire Department headquarters, there is going to be a free Narcan training, and Narcan is going to be distributed. And this event is entirely sponsored by Safe Coalition, the Franklin Police Station, and the Franklin Fire Station. All residents of any community are welcome to come down and receive free Narcan and free Narcan training. The event will go from 4 o'clock p.m. to 8 o'clock p.m. It's a rolling walk-in basis to get your Narcan and get trained. The training takes anywhere from 10 to 15 minutes. We really encourage the public to come down and get that, and we'll tell you a little bit more about why we want the public to have Narcan shortly. Along with the Narcan training, we'll also be doing CPR training, the hands-only portion of CPR training. And that training will take place at scheduled times between 4 and 8 o'clock. So I would urge you to go to our website, which is www.safecoalitionma.com. You'll see a link there to register, and you can register for a time to take nearly all of the CPR course that you need for certification. There will be information provided there to complete your certification that Chief McCraraher and his staff will provide. So this is really a great opportunity for the community, and once again, it's open to all residents of any community in our listening geography. But it's really a great opportunity for them to get some real experiences on how to save a life. From there, we have in March, the next event coming up will be Dr. Ruth Potay, who is a nationally recognized expert in the area of addiction, particularly as it affects young minds. So she will be lecturing at the Franklin High School on March 16th at 7 o'clock p.m. Excuse me, the subject will be the adolescent mind and substance use. This is a subject, Ann, that's on a lot of people's minds, health teachers. It certainly is something that we hear in the schools, and parents are certainly concerned about it. And Dr. Potay has taken a great deal of effort in becoming an expert in her own medical practice to find out just what does it mean when our youth start experimenting with substances, any mind-altering substance. From there in March, we will have another Narcan training at the Foxborough Fire Station headquarters. That date is yet to be determined, but keep your eye out for that. From a fundraising standpoint, because we do need money, and we'll talk a little bit about that in a little while to keep our efforts going, We have a wonderful 5K, Jen, that Jennifer's the chair of the, in addition to being the vice president of the coalition, she's the chair of the high school peer-to-peer group, which is a great group of young men and women who have dedicated a large part of their community service time to helping the SAFE Coalition.
I wasn't aware of that.
It is fabulous, yeah. It's wonderful, and 3 seniors are doing their senior project with us, the SAFE Coalition, for the 5K. So starting at the end of March, 3 seniors will be working with me pretty much daily on learning more about substance use and different styles of support, and they are hoping to study that when they go to college. So they really get some wonderful hands-on experience and meet leaders in the field before they even are graduating high school. And then to cap it off, we'll have the 5K.
Are they helping do the 5K?
They are. That is their
thing.
senior project.
Yeah.
Yes.
So they're actually doing that whole, okay.
Yes. So they have gotten in touch with Adidas. We have 10 running sneakers that have already been donated by Adidas. We have a few great other items that I don't want to talk about yet because I want them to talk about that.
Yes.
But we are hoping to have around 200 people at the 5K. They've notified 5 other local high schools that are working with their seniors to also participate in this 5K. So,
do you think I could have them on my show?
Yes.
Wouldn't that
So
be so
that
wonderful
is
idea.
it. They
In fact, we've got-
are passionate. They
They've
are
got-
I've got it. That
incredible.
would be
They are
wonderful.
dedicated, and they are so excited to really learn about addiction, learn about substance use, and also really participate in the community and getting the community more aware of this cause. as
And
well.
a special note to parents, please, wherever you're watching us, this is open to any high school age youngster, and I say youngster, my gosh, that dates me, huh? Young man or woman, but we would love to have more people involved. So please contact the SAFE Coalition. You can go to info@safecoalition.ma.com and drop us an email. Just say high school peer-to-peer in the subject line, and we'll put you in touch with Jen, and they have a great time. I should give you the date of the road race. It's May 7th, 2017. And what time is the road race?
The road race will start at 8 a.m. and we hope to be finished by noon.
Terrific.
And the road race is called Race for Recovery.
Oh,
Is it
man,
open to all
that's
age
great.
groups?
All
so
age
I can
groups.
enter it?
Absolutely.
Very good.
Excellent,
Absolutely.
excellent.
We
So-
take everyone.
And there will be trophies
That's
based
what
on
that's why I asked.
absolutely.
My
I
age
know
group,
in
sometimes
There
the only
will.
one, and then I
Absolutely.
win.
You'll get a bib. You could get a trophy. There'll be water. There'll be music. There'll
right.
be dancing.
This is going to be great.
It's going to be
Jennifer
fabulous.
throws a great party. So that's May 7th. That's May 7th, 2017. It's going to be a lot of fun, as you can tell. And we're looking forward to that. And then we have our golf tournament at Franklin Country Club on May 22nd. That promises to be a great day. We had a fantastic turnout last year with
Amazing.
very little planning time. This year we have a ton of planning time, and this will sell out. And registration is open for that on our website. Again, these fundraising events are critical to some of the services I'm about to tell you about in a minute. And without money, we have no more state grant money. We don't receive any private grants, although we are applying. But it's difficult to come by, and we're all volunteer-led. So we really depend upon our community, and the business community has been tremendously supportive of us. So just down to some of the nitty-gritty on what's been going on, Jen, the first thing that I'd like to mention is our telephone support line. And that line was designed and is being run as a resource line for people that are looking for access to treatment or supportive services. So what might you expect? When you call our line, you will get a trained volunteer who will answer the phone between the hours of 9 and 9 p.m., 9 a.m. to 9 p.m., and if not, it will go to voicemail and be returned promptly in the morning. But you can ask any question that relates to treatment. How do I get my loved one into treatment? Can you help me get my loved one into treatment? Can you help me access Section 35, which is involuntary commitments? Can you help me find counseling? Can you help me find supportive services for my family? So the design is that it's not unlike a hotline where you might expect crisis help. This is a resource line, and it's one of the biggest problems I know as a dad with a son that's an addict, suffering from substance use disorder. It's the number one thing I needed was resources. Right. So if you're in crisis, please call Emergency Services 911. If you need resources, please call 508-488-8105, and that is our resource line. Secondly, I just want to mention that we have our support groups are running and continuing to run and continuing to fill up. Jen, you were running Healing Hearts, and when does that run?
Healing Hearts runs on Thursday nights at the second floor of the YMCA in Franklin from 7 to 8.
Mm-hmm. And what is the construct of Healing Hearts? Who might go there?
So the majority of folks that attend Healing Hearts come most recently after they've experienced some kind of loss. For some folks, that means that their child or loved one has overdosed and passed away. And for others, that means that their child or loved one has left the home or has gone to detox or is staying with another family member. And so what we traditionally see is we have folks stay with Healing Hearts for 3 to 6 months. And after we do some immediate grief work, they go on and transition to either a different support group, or they go to outpatient therapy, or we continue to see them kind of on a mobile basis where I'll go and visit them in the community. Maybe we'll grab a cup of coffee, but they don't always need to sit in a small group like they were 6 months earlier.
Yes. Very intimate setting,
yes.
As you've described. And is there any cost?
No, free.
No cost, free of charge. It's fantastic. We're really fortunate to have that in this community, and your expertise and your generous heart. And I speak for a lot of people when I say that. We also, on every Monday night at the First Unitarian Universalist Church at 262 Chestnut Street in Franklin, have Learn to Cope. And Learn to Cope is a support group. It's less intimate than what Jennifer just described. There's usually anywhere between 35 and 50 people there. But it's a support group for loved ones and families of those that have that have a substance use disorder problem in their family. So you might see parents there, sisters, grandparents, and the like. And it's an open format. You can come in. You either can share or not share, all depending upon what your appetite is for that particular evening. Importantly, Narcan is distributed at these meetings, and training on Narcan happens at those meetings. And again, that's Monday evenings at the First Unitarian Universalist Church at 262 Chestnut Street, 7 p.m. in Franklin. And then finally, we have a support group that actually runs out of Milford Hospital, and it's in Conference Room C in the main building right by the cafeteria, and it's called Road to Recovery. This group is really interesting. They use the big books of Alcoholics Anonymous, the 12-step program, to tackle the issue of codependency. So people that are codependent to their loved one that has substance use disorder, they use the same book that they would use in a big book meeting, and it's very, very powerful. And that is run by Katie Truitt, a tremendous mentor and friend to all of us that are struggling with this. So, just a couple of other quick things before we move along, Jen. I thought that while I've mentioned Narcan on several occasions, I thought maybe it might be an opportunity to show people what Narcan is. So Narcan has traditionally, again, the actual name of Narcan is nasal naloxone. That is the name of the drug itself. And Narcan is the trademark name. And this is used to reverse an opioid overdose. Okay? So when you have an opioid enter the blood, it's going to bind to an opioid receptor, just like this. It's going to lay over it. The central nervous system is depressed, and the person starts breathing slower. If they are overdosing, they then either stop breathing or the breathing becomes so labored that they aren't able to maintain their function. When Narcan's introduced, it simply antagonizes the opioid to jump off of that receptor. Importantly, it doesn't flush the opioid out of the system. So the opioid can reattach to the receptor, which is why the first step always in any overdose, and by the way, this is not meant to be a Narcan training. I'm just giving some highlights. Right. But the first step on any overdose is always to call 911. This is the what we'll call the older form of Narcan. It comes packaged. I put together the atomizer, which goes on top, converts it into a spray, and this vial holds 2 milligrams of Narcan, and it's designed to simply be an injectable. When I say injectable, I should say a misted spray into the nasal cavity. And I can even give a little bit of a demonstration, I think. Whoop, there we go.
Yeah,
bingo.
there it is.
So this is actually water in here right now. But so it's simply used to spray up each nostril. It's 2 milligrams. Each one of these boxes comes with 1 dose of 2 milligrams. And typically you'll receive 2 of these boxes, so you'll have 4 milligrams on hand. This is available by going to any Walgreens, CVS pharmacy, or any pharmacy in Massachusetts and requesting it. Okay? Or you can come to Learn to Cope and Be Trained. The second type of Narcan is really neat. This is brand new, and they did away with the atomizer. I just took it out of the package, and it looks almost like Afrin. And the thing I love about that is that's a 4 milligram dose. It's the same thing. It's designed to be inserted into the nostril. Same medication, but more bang for your buck. It's 4 milligrams. I won't touch the bottom because all 4 milligrams will shoot off into the air. So that is what Narcan is. Again, the Narcan training coming up on February 15th. And beyond that, the coalition is very busy. We continue with our chiefs of police roundtable meetings. We continue interacting with D.A. Morrissey and his crew and trying to work with other coalitions to be innovative and on top of trying to get this epidemic, trying to provide solutions to our community to help stem the tide.
One of the things I was going to ask you, Jim, just as I was watching you put, demonstrate Narcan, and some of the things I hear out in the community, and I think it's maybe from some misunderstanding, is some people, when they talk of this, say, well, once someone, overdoses and they use Narcan, and then if we have to use it again, they haven't learned their lesson. And what good does it do? They're choosing not to. It's really a waste. Why are we doing this? Can you speak to that? Because I think it's a legitimate question, but I think we really need to educate people about that.
I love the question.
Yeah.
Because it's provocative.
Yeah.
And I think who hasn't thought that?
Yeah.
You've heard it,
And
right?
we get that question more often than not, a few times a week.
We get it all the time. So what I would ask somebody is, I'm going to use a quick analogy. I'm at Burger King, and I eat there every day.
Yeah.
And I'm standing in Burger King getting my usual 2 Whoppers, supersize the fry, and supersize the non-diet Coke. And as you know, I smoke Marlboro Reds, and I have the pack in my pocket prominently displayed. And all kidding aside, I have a heart attack, and I fall onto the floor. A person might look at that person and say, well, you know what? They're doing it to themselves. There's a defibrillator on that wall, which somebody's going to have to recharge at a cost of roughly $86. I'm not really sure I want to do it. And that's not really what we do we? Right? We defibrillate them. We get them first quality medical care. We get them into the hospital for a very small copay. They get something called cardiac rehab for as long as they need it. And they're back with us whether they agree to stop smoking or stop eating Whoppers or not. Many of those people do go on successfully and lose a lot of weight, quit smoking, and rehabilitate their hearts because it's a major wake-up call. For $26 max, that's what this is. This is giving a person one more chance to enter rehab, one more chance to go back to their family and loved ones, have an intervention, and get back into rehab.
Chance, right. And don't
So
you
thank
think,
you for asking.
too, though, that there's a little bit of a misunderstanding, too? Something I've learned more about is that how the brain actually changes from the use of opioids and how very difficult it is to get rid of this addiction, how the pain of the withdrawal alone when someone stops and the how many times people relapse because it's such a terrible addiction, right? I mean, disease, isn't it?
It absolutely. And disease, the way that we're thinking about this addiction is that it is a disease, and that at some point there's a shift from taking a drug by choice to needing the drug to live.
Right.
And so for so many folks, they know that their life would be different and possibly better if they weren't taking this drug. And at the same time, they are scared of the person that they are without the drug. They don't know how to live their own life again without the drug. They are scared of what the withdrawal will be like because they haven't felt pain because they've been numbing themselves for so many years. And so for a lot of folks, it is easier to stay on the drugs even when they know that it's ruining other parts of their lives than to get off of it. And so that is why it takes a village. It takes a family. It takes a lot of loving, caring people to support someone through their decision-making process, love them through it, and then absolutely be there when they either overdose or decide to get support, kind of away from the family and away from their friends. And what we have noticed and what we do know is that every time that someone has an overdose, there is not oxygen getting to their brain. Similar to when we were growing up and our parents would say, don't hold your breath under the water for too long. This is exactly what is happening. So if someone of a younger age overdoses 4, 5, 6 times before they're in their 20s, they're already doing a lot of damage to their brain. So they are going to need a lot of support and rehab to get their brain back to a healthy place to even be able to make decisions about how to live their life differently.
So it's even they lose the clarity about decision making because of all the
Yes.
damage that's been done. It's so complex, isn't it?
It is. It absolutely. And opioids are interesting. They hit 3 different parts of the body, and so 3 parts of the body are affected. And so it's hard to make wonderful decisions about your own life when 3 big parts of your body are saying, we don't feel any pain. This is good for us. This is how we function well. And so most of us, when we don't feel well, we'll see the doctor. If we break a leg, we put a cast on it. If we have a headache, we'll take some kind of Advil. And so what opioids say to the person who's taking them is, I'm doing fine with all of this. I don't have a problem. I don't need a cast. I don't need Tylenol. And it's masking all those other feelings that are coming up.
Right. And thank you, Jen. One of the resource guys, so when somebody does overdose or we have somebody in crisis, Steve Spiewakowski and some other folks on our board of directors were in charge of a committee that came up with this wonderful booklet. It's printed by the Safe Coalition. It's called What Do We Do Now? And this booklet is being carried by over 11 police and first responding communities in Norfolk County in the Rentham District Court County areas. And this is a great booklet for officers to leave with a family, and it's so brightly colored and spiral bound. Steve really and the committee thought of everything because they didn't want it being lost underneath mail and that type of thing. But it covers detox, literally, what do I do now? What is detox? What is aftercare? What is medication-assisted treatment? What are the signs of substance use disorder? What are some family supportive services and how to get them?
That's been needed for so long. This is great.
So it's a terrific little mini guide to help get a family started. And, of course, our phone number's on there as well, our resource line. So this just gives that person one more chance to get the resources that they want.
Yeah. You know what, in talking to both of you, I'm struck by 2 things. I'm struck by, and from all of our previous shows that we've done, is the enormity of this disease, this issue in the public, and how it's impacting old people, young people, across every socioeconomic level. It is the number of lives that are impacted, the deaths we've seen, particularly of young people, the severity of it. And then on the other side, that it's a group of volunteers that are doing it all, and say this huge social issue and volunteers. So when I ask you, one of the questions as I was listening to you talk, I said I've got to ask this question. If you had it, the needs as they exist, all things. If you could have a wish list of what we need in our community, let's home in on our community and say, okay, what if we had what we could really needed, what would you say that the supports we could benefit from or use in our community? What would you say to that?
Well, I think kind of looking big picture and putting that dream out there. For me, community support and nonprofit organizations, the dedication needs to be to listen to the community. And we have been listening to the community, and we have been hearing that the community would like more supports by way of support 24-hour care. So maybe that means instead of just having a resource line, that we have a crisis line, that we have trained clinicians, that we have a mobile team that can meet with people during the workday when we're having our other jobs because we are volunteers. I think anytime that we look at a community that's had significant loss due to opioid addiction, not too far after those losses, there are increases in diseases like hepatitis C. So developing a needle exchange program, having visiting nurses, having more counselors who can talk with families before, during, and after crisis events happen. It would be wonderful to be more connected with the school systems and with the youth, whether that be talking with sports teams or going into classrooms. And I think on the treatment side, it would be incredible if we had the capabilities to spend time going around Massachusetts and Rhode Island and the New England area meeting with treatment programs, because we want to develop a container for the folks in Franklin and the communities that we're working in to get the best treatment options for them. That means us having an excellent knowledge base on insurance, who takes what insurance, how to manage the insurance kind of wavelengths, and then knowing who to call and what treatment place is wonderful for someone. For instance, there have been times where someone comes to us and they say, I'm an addict and I want help, and I also really like the outdoors, and it's the only place that I feel safe. So if we could find a treatment program that caters to wilderness therapy and outdoor support while managing that addiction instead of a more clinical hospital setting, for that one person, that may make the difference.
Jen, that's such a good point. We have volunteers and spending hours and hours and hours happily of their own time, but it's tiring to familiarize themselves with this. We're so fortunate to have somebody with Jennifer's skill set, and we have a lot of people. I could go on and on and on about the incredible skill sets that we have around the table. That's what makes this coalition work. But you make an excellent point. And to date, in 6 months, we've had 54 calls to our resource line that have been placed in treatment. And by treatment, I mean they've either been given referrals to psychologists, psychiatrists, and intensive outpatient program, or actually placed in rehabilitation, inpatient rehabilitation. This is all volunteer-led. This is 100% volunteer-led. I know down in East Bridgewater, they're doing even more than that in terms of they've been around for a little bit longer and have more time to develop it, but it's all volunteer-led. To me, it's... if Eastern equine encephalitis were killing people at the rate that we're killing them right now, and I've said this before, we'd have helicopters in the air, we'd have town committees meeting, we'd have it would be a all hands on deck. We're going to lose 34,000 people in the United States this year. That's more than car accidents. That's eclipsing all kinds of numbers, and so. Locally here in Norfolk County, we lost 166 people last year. It's unacceptable.
It's unacceptable, and I think too, when you look at the issue of dealing with those that are currently suffering, with this disease and all of the issues that arise from that, then we look at the whole prevention spectrum and the investment in because we look at the mental health issues and we see them surfacing from very young ages, right? And what could we put in place as a community? Certainly it can't all fall on the schools, but what are the services then we could put in place in terms of prevention and groups for kids and identifying early when those that might have some of the issues that are associated with substance use, such as depression and anxiety and things that we see when kids are we've got to start intervening. Yeah,
absolutely. I mean, how incredible would it be to be able to have, like we have a Chiefs Roundtable, a doctors roundtable, where doctors or providers in Franklin and the Franklin towns are able to come together and talk about opioid addiction or prescribing and how that their practices are changing. Because even with our police chiefs roundtable, there is so much sharing of what is working and what isn't. I think it would be wonderful if we could do that on the prevention side and in one way have doctors communicating how their practices are changing. And then at the same time, I think working with children and education is fantastic. And I think that parents want the best for their children even if they can't provide it themselves. So what I mean by that is parents may be able to identify that they have an addiction, whether they be an alcoholic or a drug addict, and they might not know how to talk with their children about that. But if we could intervene at an early age and create a container for parents, like a parent would sign their child up for a swim class, have the sign their child up for a class that just talks about relationships and how to understand behaviors in a very child-centered way,
Right.
I think that we could do that. I think the possibilities are endless, but prevention for sure. And really kind of looking long-term, what happens in areas where addiction is high? What happens in areas where overdoses are high? Are there more diseases? Yes. Can we prevent those? Absolutely. Are there ways to be safer? Yes.
And you know, the other thing that occurred to me is we've had really, really strong buy-in from our state representatives. We have Jeffrey Roy, who's led the charge on this, and most recently Sean Dooley, Rep. Sean Dooley. And so we have the ear of government officials. We have local town officials. We have Bob DeLorco and Judy Pfeffer, who's been
they've just been so wonderful.
They're
having
incredible.
Yes, it makes such a
Tremendous.
difference.
Yeah.
So as Jennifer says, container. That to me, that's a term. That's a PhD level term for something. But I can sort of understand what you mean. Believe it or not. But really, what we are is a container for, with all of these roundtables, is information. And when we have an issue that comes up, say in one of those doctors' roundtables or the police chief roundtables, we have state and local representatives that can take up the fight to introduce legislation. I'll give you one concrete example. It wasn't introduced necessarily by Jeffrey Roy or Sean Dooley, but the protective custody law changed recently so that you can PC somebody now.
When you say PC someone, what do you mean?
Well, so they can be taken into protective
Okay,
custody
got it.
while they're impaired by drugs. Believe it or not, that law was written, I think, in the 30s, and until just a few months ago, a police officer could only place somebody in protective custody if they were drunk via alcohol.
Right.
And so you imagine how antiquated that was. But so I think some real change could happen. School committees, there could be all kinds of, if we had that type of environment in which to work.
Don't
Does
you think
make
that
sense?
has to be the focus of our next programs too? We have to start bringing more people in to keep focusing on this community issue, don't you think?
I couldn't agree more.
Does that make
Yeah,
sense?
absolutely.
Good.
Well,
So
thank
is
you.
that we want to close it up, and we want to thank everyone for joining us today, and we really appreciate the support. I don't know if you want to add anything, Jim. As
Well,
we
I just
close?
want to add that we can always use more hands. We would love to have you join the Safe Coalition. We're always looking for more volunteers. You can join us at any one of our meetings. We meet the last Tuesday of every month at 7 p.m. at the Franklin Municipal Building. So, again, please don't forget about our resource line. It's 508-488-8105. There will be links to registering to all of the events mentioned in the show along with our website. So again, thanks for watching. For Dr. Ann Bergen and for Jennifer Knight, I'm Jim Derick. Thanks for watching.
This program was made possible by your Franklin friends and neighbors, good folks just like you. Thanks for supporting Franklin TV. And thanks for watching.